Hi, I'm Mallory Go. I'm a public health concentrator, and this is Spaces of Brown Research. My project is Traditional Midwifery to Clinical Obstetrics, Historical and Feminist Analysis, and uses the John Hay Special Collection to go through history looking at the progress of female birth attendants to clinical obstetricians and the societal factors at play of how we view maternal bodies and birth as an event. I was looking for fellowships to do over the summer. I had done more STEMmy fellowships in the past, but I wanted to do something more humanity-based. I was looking from the Stone Ages, so like back during when we were discovering fire and what medicine was. But the John Hay primarily has resources from the 1500s to modern day. And I was looking at what was going on in the scene when a woman was pregnant or about to deliver, who was there, what they were doing, what positions people delivered in and why, as well as kind of norms. So what was the normal birth scene and attitudes around pregnancy and delivery and the pregnant body, and why what was going on back in the 1500s is different from how we do pregnancy and delivery today. I looked at William Hunter's, I can't pronounce it, it's in Latin, Atomica Uteris Gravid, and it's this 2-foot tall book that shows a 9-month pregnant cadaver in different positions, and it was kind of revolutionary for the time because it prompted the style of anatomy images that we see today versus abstract images before then, and they were so realistic and lifelike, and the book was very beautiful, which I didn't expect, but I definitely remember pulling out a 2-foot long book and having to try to take scans of it. In the 1500s especially, it was a very taboo topic. It was very woman-only, very close family members. In the West, modesty was a big thing. So women were mainly attended by a few close family members and a female midwife. In other parts of the world, like Asia, for example, in Japan, men physicians typically didn't touch women. So it was up to female midwives and attendants to assist in the birth. Versus now, it's a primarily male-dominated field, and it's not as taboo, but at the same time, it's not as woman-centered either. A lot of the work I do is applied epidemiology, so I use data sets, sometimes national, sometimes local, to look at trends of disease in maternal and child populations. So, for example, over the summer, I was looking at bronchopulmonary dysplasia, using the National Registry and using a coding language data to analyze trends in infants. A lot of what I see in my more coding or applied epi research is health disparities, and a lot of the health disparities have a racial or cultural factor involved in it. So I think that learning the history of different populations helps me better understand the background of why we're seeing these trends. It's important to understand the cultural context around pregnancy and birth, also looking at pregnancy and birth, not through just like a Western lens, but also through different cultures. And I think it helps understand more when interacting with patients and where they're coming from and where their historical trauma, for example, may be coming from. I really like history. I wasn't able to take as many history or anthropology classes at Brown as I wanted to, so this gave me an opportunity to really focus in on maternal child health through an anthropology history lens. I'm really glad to have participated in the fellowship. I don't think I would have gotten the opportunity to handle the materials or dive as deep into maternal child health history without the fellowship, and this kind of branched off into different projects and kind of reigniting my passions for history. So I highly recommend it.